Half a day and welcome everyone. The Committee on Health, Land, Justice, and Culture is now called to order. Today's Monday, June 27, 2022, and the time is 1:02 p.m. In compliance with the Open Government Law, notices for this joint public hearing were published in the Guam Daily Post on Monday, June 20, and again on Friday, June 24, 2022, and posted to the Government of Guam Public Notice Portal and live streamed via the Guam Legislature's YouTube channel. Notices were also disseminated via email to all senators and all main media broadcasting outlets. Individuals testifying, please first state your name for record-keeping purposes and wait to be recognized by the chair. So today's hearing is a joint public hearing between the Guam Legislature and the Department of Public Health and Social Services. It's being held as part of a requirement by the Center for Medicaid Services, or CMS, that Public Health hold two public hearings at least 20 days prior to submission of a 1115 application, a Section 1115 application. So today on our agenda is number one, informational presentation on the Guam Medicaid Drug Rebate Program, the Mdrp, the 1115 Waiver Demonstration application by the Guam Medicaid Program, administered under the Department of Public Health and Social Services. And number two, the Guam Medicaid Program intends to submit to the Centers for Medicare and Medicaid Services on or before August 1st, 2022, a written 115 demonstration application which will request to waive the mandate for the Guam Medicaid Program to participate in the Medicaid Drug Rebate Program, the Mdrp, and to receive comments on the proposed Mdrp 1115 waiver demonstration application. Number three, the CMS final rule, CMS 2345 FC, allows the territories to opt out under Section 1902J of the Act. It is through this waiver authority that the Guam Medicaid Program is electing to apply under Section 1115A1 of the Act to waive Section 1902A54, which requires state compliance with applicable requirements of Section 1927 requiring Guam Medicaid to participate in the Medicaid Drug Rebate Program, Mdrp, by January 2023. This 1115 waiver demonstration project will allow for a period for the Guam Medicaid Program to conduct a demonstration study on the potential adverse effects of participation in the Mdrp on our island pharmacy providers and program recipients. The 1115 waivers are generally approved by the CMS for an initial 5-year period and can be extended. So again, welcome to representatives from the Department of Public Health and Social Services. And of course, I want to thank my colleagues for being here today. We have our Majority Leader, Senator Talina Nelson. Thank you. We have our Minority Leader, Senator Chris Duenas, and Senator Terlaje Sizus Masi, colleagues, for being with me here today. All right. I'm going to call on the Program Coordinator for the Guam Medicaid Program, Mr. Michael Gallo. If you could please introduce your team, and then if you can begin. I understand that you have a PowerPoint presentation. I think we've put that up on our
yes, ma'am. That's
MIS,
correct.
so that will, but I've also given copies to the senators, just FYI. And let me just recognize Senator Tony Ada also for being here today, Sizus Masi, Senator. All right, so Mr. Gallo, if you could just, again, state your position and who's with you here today.
Good afternoon, everyone. My name is Michael Gallo. I'm a program coordinator with the Public Health Medicaid Program. With me today, towards my right, is Jeff St. Nicholas. He's a management analyst with the Medicaid Program, MIP. Ms. Janet Cruz, immediately to my right. She is also a management analyst working with the Medicaid and MIP programs. To my left, we have Carlos Pangilinan. He is working with the state office under the Division of Public Welfare. And Ms. Rochelle Polino. And she also works with the state office for the Division of Public Welfare. Oh, Polino, Rochelle Polino.
Thank you. You may proceed.
Okay. I wanted to first thank you, Speaker Terlaje, for assisting us in presenting this information to the public. We definitely want to also thank Senator Nelson, Senators Ada, Taitigui, and Senator Duenas for attending the hearing as well. We can go ahead and go to the presentation. So what we're doing today is we're presenting information with regards to the Medicaid Drug Rebate Program. And this was brought up because of a legislative rule that was passed requiring the program to participate in Mdrp, Medicaid Drug Rebate Program, by January of 2023. However, the legislation that included the territories for participation in the Medicaid Drug Rebate Program also provided for an 1115 waiver demonstration, which would allow us to opt out for a period of time. And so, next slide, please. So the Guam Medicaid Program is conducting this hearing to inform the public, our program recipients, Medicaid pharmacies, providers, and other stakeholders of our intent to submit to CMS, the Centers for Medicare and Medicaid Services, this 1115 demonstration application by August 1st of 2022. This will request the program to be waived from the federal mandate to participate in the Medicaid Drug Rebate Program. During this time, we would also receive comments on our waiver demonstration so that we could submit this as an additional information on the application to CMS. Next slide, please. So we're going to go over 4 main discussion points in today's hearing. The first being the explanation of the Medicaid Drug Rebate Program, the mandate that was created because of the final rule legislation. The second discussion point we would be covering would be the 1115 waiver demonstration. In speaking with a lot of people that have shown interest in these type of waiver demonstrations, there's been some confusion on what exactly an 1115 waiver is, so we'll attempt to define what that is and how it's normally used, and some of the requirements in order for it to get approved. The third thing we wanted to kind of go over was because the Medicaid Drug Rebate Program would affect the Guam Medicaid prescription drug benefit to our existing participants, and the mentality was that in participating in this Mdrp, it would provide a cost savings. We wanted to go over what we currently do for that benefit under the program and the measures that we have we're currently using to maintain our costs, so that doesn't inflate. The final area that we're going to be discussing will be talking about the Medicaid Drug Rebate Program. In our initial assessment of implementation, there was some areas that were concerning, and so hence the 1115 waiver assessment. We'll go into further explanation about the 1115 waiver assessment and the evaluation that will be conducted during this period of time that we're requesting CMS to waive our participation in Mdrp. Next slide, please. So the first area that we wanted to cover was the Medicaid Drug Rebate Program. And to explain a little bit about what this is. So the program includes CMS, state Medicaid agencies, and drug manufacturers. This agreement that would be arranged under the Mdrp would help to offset the federal and state costs of outpatient prescription drugs dispensed to our Medicaid participants. Although the prescription benefit is not a mandated benefit, it's something that all states do cover under the Medicaid program. Next slide, please. So we wanted to explain a little bit more again about what the Medicaid Drug Rebate Program is. So this program offsets costs of prescription drugs by requiring drug manufacturers to enter into an agreement with the Secretary of Health and Human Services in exchange for the Medicaid program covering all the manufacturers' covered outpatient drugs or CODs. So manufacturers are responsible for paying a rebate on those drugs that are paid and dispensed under the Medicaid plan. The rebates are paid by the manufacturers on a quarterly basis. And that rebate goes to the states, but it's shared between both the states and the federal government based on the FMAP. Next slide, please. We wanted to just briefly go over how that rebate structure is set up in the Mdrp. And if you take a look at the three categories, there are brand drugs approved exclusively for pediatric indications and certain clotting factors, and then generic drugs. So each of these categories, they have a formula that determines a percentage of what's called the average manufacturer price. So normally the formula would be the average manufacturer price minus the best price given to wholesalers or drug distributors, or 23.1% of AMP, whichever is greater. Plus there's an inflationary component that's also added to that as well. So that's how the rebates are formulated. Next slide, please. So what we wanted to cover here under this section was to share with you the first legislative action that provided for the inclusion of territories. So on February 1st, 2006, there was a final rule that amended what was stated under the Medicaid Drug Rebate Program that all states would participate. Now, initially, states only referred to actual states and not territories. So this final rule actually initially amended the language to include territories under the definition of states for the Mdrp. It also created the provision for the 1115 waiver demonstration to opt out. Next slide, please. So why are we here today? Well, here in this slide, we can see that on November 19, 2021, there was another final rule that mandated the territories under the inclusion of Mdrp with the definition of states to include the territories to participate by January 1st, 2023. Next slide, please. So that brings us to our next topic of discussion, which is the 1115 waiver demonstration. So under Section 1115 of the Act, CMS may authorize the state to conduct experimental, pilot, or demonstration projects that, in the judgment of the Secretary, are likely to assist in promoting objectives of the Act. So the Secretary may, under Section 1115, waive provisions in Section 1902 of the Act, and that's what we're requesting, that the Secretary approves our 1115 waiver demonstration to temporarily waive our requirement to participate in the Medicaid Drug Rebate Program so that we can assess how participation will actually affect both our participants, the pharmacy providers on island, and our actual program costs. So just to be clear, in the slide it points out that although waiver is included in the language there for the 1115, it's actually an experimental pilot or demonstration project. So it's basically a study. We wanted to apply for this to study how it would affect it. So some of the things that we needed to be aware of with the 1115 waivers is that it must be budget neutral. So that means that if it's approved, it would not cost the federal government more than if it didn't exist. So budget neutral. Next slide, please. So in order for this 1115 waiver demonstration to be approved, there are several requirements with regards to public notice that we need to meet. So CMS requires 30-day state public notice and comment period for this 1115 waiver. We need to conduct 2 public hearings at least 20 days prior to submission of the 1115 application. Public notice information, including the notice comment process and a copy of the application, needs to be posted on our site. And some of the components of our application are still a work in progress. We've been working with CMS to develop the evaluation design portion of the 1115 waiver. And I'll go through that a little bit more in one of the other slides. Now, when we submit the application to CMS, there's also a requirement for them to do a 30-day federal public notice within 15 days of receiving our application. So there are timelines that we're trying to meet in order to get this approved before the January 1st, 2023 implementation deadline. Next slide, please. Now, 2 other areas of requirement would be the monitoring and compliance of the 1115 waiver. So if it's approved, we have to do periodic reviews of the implementation of the waiver 6 months after it's implemented. We also have to have a public forum to solicit additional comments on the progress of the waiver, and a public forum must be held annually thereafter. Now, as mentioned, the 1115 waiver demonstrations are usually approved for a 5-year period, and that's what we're currently looking at. Now, that doesn't mean that once they do approve it, that it will be for the entire 5 years. It'll be assessed based on the reports that are submitted annually and based on our findings. Okay, so the other reporting requirement, or the other requirement is a reporting requirement. So we need to submit a draft annual report to CMS, and it must be published on our department website. We also have to publish a final report after receive receiving comments back from CMS. Okay, next step. Next slide, please. Okay. So there are different components to this 1115 waiver demonstration. As I mentioned, it's actually a request for a study. And so in this study, there's a hypothesis that needs to be presented, and this is the hypothesis that we came up with at first glance when we looked at the requirements of the MDRP. So Guam Medicaid's participation in MDRP could adversely affect on-island pharmacy providers by creating an unreasonable requirement for them to carry all of the MDRP participating manufacturers' COD, such that it would be difficult for them to maintain adequate inventory. We wouldn't be able to pay for any medication that wasn't covered under a manufacturer that was in a MDRP agreement with us. So this inventory requirement may be prohibitive for them to continue as providers on the Medicaid program. Additionally, it would be more costly and labor intensive due to required administrative costs for the program to participate in the MDRP, and these costs would outweigh the rebate savings the MDRP would provide. So there's an additional administrative costs. We would have to hire a contractor to track all the medication that was dispensed, come up with a quarterly report that would have to be submitted to the drug manufacturers in order for us to get the rebate. We don't have a grasp yet of what those costs would be, but that's what this request for the 1115 waiver would allow us to do the study, to see what those costs would involve.
What is, Mr. Gallo, what is COD?
Those are
Costs?
covered, I'm sorry, it's not cost, it's, sorry. It's okay.
It's covered outpatient drugs.
Yeah, covered outpatient drugs. Yeah,
Covered outpatient drugs.
covered outpatient drugs.
Okay. So this
That-
is the,
that
this is the
basically
crux.
is
This
the-
hypothesis is the crux of what you're submitting to them. This is the study you want them to conduct. A stu-
This is the study that we will be conducting.
Oh, you, I mean, okay, you will be conducting.
Yes, that's correct.
To hold off while you conduct this study.
Right, so the covered outpatient drugs is actually their entire line of drug formulary that the manufacturers produce. Okay, next slide, please. So this third area, the Guam Medicaid drug prescription benefit, we wanted to discuss some of the measures that we take currently under the program to minimize our costs in this area. So currently, the Guam Medicaid program has a closed drug formulary. So we're able to control the types of drugs that can be administered under the program or dispensed. We don't normally allow for brand medication unless requested, documented, and medically necessary. Additionally, the pricing is established in January of each calendar year based on the lowest wholesale price listed on Red Book. Now, Red Book is a listing online subscription for drug medication price, and it's updated on a daily basis. So these control measures have historically allowed the Medicaid program to maintain a relatively low expenditure for our drug prescriptions. I believe the average that we were looking at, it was maybe in the neighborhood of 17–18% of total costs for the program. And medication for the Medicaid program is probably one of the higher areas that you see costs. Next slide, please. So at first glance, during our initial assessment, one of the things that we had identified that currently the island pharmacies face challenges. They have a difficulty in obtaining supplies due to our remoteness here in the Pacific, relative to supply chains. Now, oftentimes the drug wholesalers or medication wholesalers are not negotiating with our local pharmacies. So they pay whatever the drug distributors list as the cost for the medication. And on top of that, they additionally would pay the cost of air freight. So this is one of the things that our local pharmacy providers had mentioned to us. And with, these added costs creates a hardship and a burden for them. And so we had initially come up with the impression that this, having them cover all or carry all CODs for manufacturers under the Mdrp would create a hardship or additional burden on them. Now, the additional burden, one of the things that we were concerned about was that it may be too costly for them to continue on the program, which may cause them to drop from participation and would create our participation access problems, where our Medicaid participants or recipients wouldn't be able to receive their medication through online or on-island pharmacies. Next slide, please. Okay, so this next area of discussion talks about the Mdrp implementation and some of the things that in our evaluation design we would want to look at. And so we came up with some questions, and these were the areas that we would base the evaluation design around and collect data to prove the hypothesis. So the first question, what are the existing supply chains, pharmaceutical distributors available to on-island pharmacies? Second area was, what current limitations do on-island pharmacies have in dealing with existing supply chains when ordering CODs for Mdrp participating manufacturers? Third area, how would Guam Medicaid participation in the Mdrp affect on-island pharmacy providers' decision to continue as a provider on the Medicaid program? Now, some of these assessments wouldn't be in actually gathering data. That third area, we'd probably have to do a survey to see what the pharmacist's thoughts on the matter would be, and then try and assess that way. Next slide, please. So these last two areas that we thought of trying to do the assessment and including this in our evaluation design was for these two questions. Would the cost reduction for pharmacy expenditures outweigh the adverse effects of creating potential inadequate participation access to on-island pharmacy services? And then lastly, what other costs would be involved in Guam Medicaid's participation in the Mdrp? And would these costs outweigh the benefit of the rebate savings to its pharmacy expenditures? Now, at first glance, again, when we did an assessment, it appeared that the Mdrp program is a complicated program. So we would probably need to have an additional full-time employee just to manage that particular aspect of the program. There are other areas we would have to contract with a vendor that would be able to track all the dispensing of medication, both in the pharmacies and in the hospital settings, so that we would be able to report that back to the manufacturers and obtain the rebate. Now, we don't have a grasp yet of what those costs would be, but we were currently looking at reaching out to U.S. Virgin Islands, since they're similar in size to our program, and see what their costs are as they try to implement the MDRP, and use some of their data to do our assessment. So the last note, again, it's just to be open that we're currently working with the Guam Medicaid Program, or with CMS, to develop our evaluation design for the 1115 waiver. As soon as that's completed, we have several Zoom meetings set up, but again, as soon as that's completed, that will be published on the website. Next slide, please. So in conclusion, we've discussed the 4 points here. We've discussed the Medicaid Drug Rebate Program and the mandate that the Guam Medicaid Program now participate in this drug rebate program by January 1st, 2023. Because of that, and using the 1115 waiver demonstration, we're going to opt to request for a period of time to do a study to assess. We also went over some of the control measures that we use to limit our expenses with prescription drug benefits. And then lastly, we covered some implementation challenges with starting the MDRP, and how those areas will be included in our evaluation design as we work with CMS to finalize that. Next slide, please. So that concludes the information briefing that I had. Did you have any questions?
Thank you, Mr. Gallo. I'd like to recognize, in addition to the senators present that I announced earlier, the presence of the Vice Chair of the Committee on Health, Senator Sabina Perez, also Senator Joanne Brown, and also we have with us today in our audience former Senator Dennis Rodriguez, who is currently the Governor's Chief Advisor on Health Care. That was announced recently. Yeah, if I could start with a couple questions. One is, how long are you going to request a waiver for? In other words, how long is this study going to take?
Well, normally when the 1115 waiver demonstrations are submitted, they're usually approved for a 5-year period. But again, that may continue for the entire 5 years. There is that reporting component that we would have to meet on an annual basis. There's also a quarterly report that needs to be submitted to CMS as well.
So the questions that you've listed, I know you're working with CMS to finalize this design, but the question that you've listed, they don't seem like they would take that long to answer to me, but I'm not sure. And so I just wanted to note also for the record that we invited the Guam Board of Examiners for Pharmacy, and we asked the Department of Public Health to invite all pharmacies on Guam to this hearing, so they were notified?
Yes.
Okay. Yeah. Do you think it would take that long?
The Medicaid Drug Rebate Program has quite a bit of requirements in order for us to implement it. We don't have a comfortable grasp yet on what that would entail. the cost involved. And so this 1115 waiver demonstration application was just a way for us to gain additional time. We're looking at January 1st, 2023. And
Okay, so if you gain additional time, 5 years, what happens during the 5 years to reimbursement? Is there any reimbursement or is there none?
no, if we don't participate in the MDRP, there's no rebates that would.
Okay,
However, the rebate, during the study, we wanted to assess whether the additional cost to the program outweighs the
Right.
rebates that we would receive based on our current control measures.
right.
Yeah.
Okay, all right. Did anyone else on the panel want to add anything before I open it up to questions from the senators? All right, then. Senator Nelson?
Thank you, Madam Speaker. Good afternoon.
Good afternoon, ma'am.
So the bottom line up front is that you're going to request a waiver. It's already been decided that you're going to move forward to request the waiver. Is that correct?
We're working towards submitting an application. We're trying to meet all these timelines, so
So that,
hopefully we'll be able to meet the timelines to submit the application. Whether it'll be approved, that again would have to be determined by CMS.
okay, and during that time, if the waiver request does get approved, you're going to do an analysis on your hypothesis that you represented. Is that correct?
Yes, ma'am.
Okay. What is the impact to the people that would partake in this program if you did not request the waiver?
The impact for the recipients would be minimal. We would still cover, well, let me take that back. The Medicaid Drug Rebate Program would open up our drug formulary, which means the Medicaid, participating in the Medicaid Drug Rebate Program would open up our drug formulary. Our drug formulary is our covered medication. And so currently we don't allow for brand medication. We don't allow for a lot of different things. So we're able to control costs that way. If we were to participate, we would cover everything that the manufacturers produce. And so there would be a rebate, but would that rebate cover the additional costs? And that's what we're trying to assess.
And who pays the initial cost?
The program would have to bear the initial costs.
The
and then-
Medicaid program?
That's correct, yes.
That's currently at 85% reimbursement rate. Is that the same program you're talking about? Where would the funding come from to pay for the initial cost specifically?
Yeah, so currently we're, the FMAP,
The FMAP?
the FMAP would be, it's currently at 83%.
83%.
With PHE, it's an additional 6.2, so it's currently at 89.2.
89.2.
Now the,
So that's a good FMAP because in previous years we had a 55%, right? Correct?
that's correct. However, we don't know what's going to happen after September 30. That FMAP may go back to what it originally was, which is 45, 55.
55. Okay. But isn't it a good thing to open up the formulary for the people and for the government to help them pay in their medication? I mean, the issue with COVID-19 is that we saw that our healthcare was greatly hindered. We did not put enough emphasis in the previous years towards our healthcare, and we saw that as a result globally. We saw people die, we saw shortage in nurses, we saw shortage in hospital staff, we saw shortage of doctors, We saw a shortage of medical necessities. We saw a shortage of medicine in general. So wouldn't it be a good thing for us to move forward with this MDRP and give the government take care of the people in this sense? Help them with their medicine? Shouldn't we refocus our efforts towards healthcare and really do it and commit ourselves to this?
I think that offering more medication to our recipients would make sense that it would be more beneficial, but covering all brand medications versus generic medications, I'm not sure if the cost difference would.
Right. But if the doctor prescribed me acetaminophen over Tylenol through the Medicaid program, is that patient going to be given Tylenol, or is that patient going to be given acetaminophen?
Well, currently, even though we don't allow for brand medication, we do allow
we
for
use
it.
this.
We do allow for it.
Right. But if we use
if it's medically necessary.
Okay. But if a doctor prescribed a patient acetaminophen and the MDRP, the Medicaid Drug Prescription Benefit, I'm sorry, what is it? Yeah, the Medicaid Drug Rebate Program, you said that it's going to open up the formulary. And so if the doctor prescribed me acetaminophen and over Tylenol, I would still get dispersed acetaminophen, right? If I'm a part of this Medicaid program? Or is the pharmacy going to say, okay, they prescribed you acetaminophen, we're going to give you the brand name Tylenol?
It's whatever
The doctor
the
prescribes.
physician will prescribe.
Okay. So just because we opened the brand formulary and we say that this program is going to allow also for brand names and not just generic name medicine, that's not always the case that they're going to get the brand name medicine. Is that correct?
That's correct.
Okay. So back to my question again, don't you think that this would be good for the people if we can participate rather than request for a waiver? If it gives them more options and the government absorbs this kind of cost? It's just a simple reprioritization, right, of where our priorities will be at the legislature, right?
Right.
So wouldn't you be advocating for that instead?
I think my experience with the federal programs is that we have to be fiscally responsible. We have to create a benefit program that would benefit the majority of the people with limited resources. And so, again, the study is not to stop us from participating if our findings.
It's to delay.
It's to allow us time to assess.
It's
'Cause
to delay.
At this point, it's hard for me to make that.
The waiver will delay the implementation of the program, is that correct?
That's correct.
And you stated that it's going to delay the implementation. The waiver can last as long as 5 years, is that correct?
It may last, but it could last only for a quarter.
Okay, but it's uncertain, right?
It would be up to
Uncertain.
CMS.
So don't you think then why don't we provide this kind of program to the people who are in most need and still conduct the study at the same time? There's nothing that stops us from doing the assessment while we're within the program. And there's a timeline for opting out, so as long as we meet that timeline, we can request the waiver then.
If we don't act now, that window is going to close. We won't be able to request for the waiver.
Okay, so it's August 1st, 2022.
Right.
And then you learned about this waiver is it in November 25th, 2019? I mean, yeah, that's right. Is that the date? You know what would have been easier is if we had a timeline and then you listed all the critical events leading up to the waiver program.
The November 2021 final rule, that set the date for January 1st, 2023. So in November of 2021,
Okay,
the program knew that it had to implement the MDRP.
Okay, but when were you first alerted about this? I was,
Yeah,
it says that in,
I could get the information. I've only been with the program since December of 2019. So I could get that information to you and provide it.
wow. You're it.
Yes, I met.
Okay, it says here in the presentation that it says, on February 1st, 2016, that was when the Medicaid Drug Rebate Program started, and then the delay date for provision relating to manufacturer reporting of multiple best prices connected to a value-based purchasing arrangement was on November 19, 2021. The rule was delayed for 9 months to April 1st, 2022. And you came in December, right? You came in just December 2021?
No, December 2019.
2019. So
Yeah.
this should have been within your time, right? That you noticed that there was a,
November 2021, I
Yeah.
think you stated for the record, right?
Yeah, unfortunately, it was in my purview. I wasn't responsible for
November, December,
this
January.
particular,
So 7 months later, we're having the hearing, roughly 7 months.
yeah.
Yeah, I'm not convinced that this waiver is acting in the best interest of the people. I'm not convinced at all, especially with the presentation. It seems like we're acting for something else. And the questions that I do have really have to deal with the hypothesis that you stated. And even if you ask for a waiver within 3 months, for 3 months you said it can be done as quick as a quarter, it just makes me question, why didn't we do this sooner in November 2021? Why didn't we act sooner if we thought it was only going to take a quarter to do this analysis? So is it within your authority that you are going to send this waiver request forward? Is that your authority?
No, I'm just assigned to work on this project.
Who authorizes that?
So the administrator would make the decision to submit
And who's the administrator?
our current administrator is Therese for the Bureau of Healthcare Financing Administration.
Okay. Madam Speaker, I'm just concerned that we're moving forward with a proposed waiver. We don't have all the answers. Perhaps the waiver was to find the answers, but there was more than enough time to collect the analysis 7 months later, and I'm not convinced that this waiver is going to benefit the people at all. That's all I have. And, thank you for your work. Thank you for the presentation.
You're welcome.
It's really just a concern of how this is going to impact the people. And it seems like it's
Understood.
going to take something away rather than give them something. And if it's something that we could do at the legislature to reprioritize how we spend our money and to reprioritize how we move going forward, then I would think that you would be here advocating to participate in this program, and we need to afford more money to adjust for the rebate, rather than requesting a waiver to do an analysis.
I understand that. Let me give you an example of some of the things that we've had to deal with. We've had Medicaid participants that have gone to a physician. I'm not sure if they're operating under their own interest or other interest, but they would prescribe a brand drug medication. And so for instance, the difference between the brand drug will be $50 a pill versus 5 cents a pill. And their reasoning behind wanting the brand drug medication is because it's a soft chew, and the participant is having difficulty chewing and swallowing. However, in speaking to other physicians, they're also able to crush the medication and dissolve it into. So in order to provide cost savings and provide benefits to more people, rather than paying $50 for a 30-pill prescription, we'd rather pay the 5 cents per pill for 30 pills.
Okay.
And not harm or hinder the health benefits of the participant in
Okay.
any way.
So I caught in that explanation that in order to give more medication to more people,
More
it's
benefits.
more benefits to more
Yeah.
people. So are you saying that you're not going to be able to give more benefits to people if we participate in this new program?
I'm not sure. I can't say that. But I'm just giving you an example of some of the issues that we face so
Is-
that we have to make a determination whether or
Is-
not.
Yeah. Is there a cap on how many patients Medicaid can cover? Is there a cap on the amount spent per patient?
No, it's just based on what we have and
And-
what our local FMAP can provide.
Right. And how do you get what you have as far as revenue? How do you get what you have?
Well, of course, that's given by the federal grantor and then matched by our local.
Matched by local funds.
That's correct.
And how do you get those local funds? Through the legislature's appropriation. So when the statement is said that there's a concern that we will not be able to provide individuals with the benefits, but if there's no cap on the benefits and there's no cap on how many patients we can provide the service to, and you receive your revenue from federal grants and from appropriation from the legislature, then it would be the legislature's job to ensure that the appropriation is supplemented.
That's correct.
So we can still cover the people that qualify and not put a cap on the program. Is that correct?
That's correct.
Okay. Thank you, Madam Speaker.
Thank you.
I
Anyone want to add?
I
Mr.
just wanted to
Pangilinan.
add that, with respect to what Mike had said, cost and the ability or the availability of a formulary listing is not the only consideration. You also have to consider whether or not, because there are other requirements, and Mike had explained already that this would then require the providers to carry all of the outpatient drugs. Now, I think the thing here is we just don't know.
So why is that a problem?
Well, we don't know what the impact would be.
So it looks like you're acting in the best interest of the provider and not the patient.
No. It's not in trying to act on behalf of the provider. It's
Okay.
making sure that the drugs are going to be available. Now,
So if they're
if a
required to carry all
provider,
the drugs, then they
if
should
a
be
provider
available.
is required to provide things that they cannot afford, then why would they then participate in the program to begin with? I mean, that's just the only consideration that, you should also think about. So, yeah, that's all I wanted to add.
So how much does the initial cost cover? Is there a formula for that?
Yeah, I don't understand.
You said that the government or the program covers the initial cost. So how much is the initial cost?
It would be the
For them.
cost of the medication.
Right, overall, right? Is it overall? Do they have to pay a copayment?
We don't currently have copayment
Okay.
under the program.
So how does that lead into what,
Maybe
lead
what
into
Carlos
what,
is trying to explain is that because our pharmacies are unable to create large inventories because of their limited resources, if we require them to carry Pfizer's entire line of medication to include all their brand medication as well as generic, that may create a hardship for them, because if the physician prescribes Pfizer, whatever it is, and they don't have it, then they try and give him another medication that they have in inventory, we won't pay for it. We won't be able to pay for it under the MDRP.
You won't be able to pay for it.
Correct. If it's not,
Who's we?
it's not a contracted medication
we?
under MDRP.
MDMP. I think also then we should take a look at the revenue flow chart, because now you're saying we won't be able to pay for it, but earlier we talked about that the government covers it and the federal program. So as far as the medication piece, to participate in this program,
Yeah, so we wouldn't be able to pay for a medication that wasn't under the contracted manufacturer. So if all the pharmacy had in stock was a non-contracted manufacturer medication, and that's all they had to fill the prescription with, the program couldn't pay for it because it's not under the MDRP program.
so is there a list of
There-
what is acceptable
Yeah,
and
so
not?
there is a list of all the manufacturers that are participating on the program, and then there are thousands of NDCs on there,
that are
tens of
not-
thousands.
That do not participate as part of the program?
No, that would be included on their COD. So there's a lot of variables that we're trying to assess, and hence
How are
the need
other-
for additional time.
How are other states and territories impacted? Have you observed or done any research there?
Well, the other states and some of the other territories under a different type of regulation. So some of them aren't faced with the issues that we have. Obviously, supply chains for a Walgreens out in the California is different from mega drugs out here. They can't negotiate for best price because the amount of medication that they order on a weekly basis, even a monthly basis, is insignificant for a lot of these wholesale distributors. You know, $50,000 worth of medication versus, 5 million sales for Walgreens, or they have no bargaining power. So they just accept the cost of whatever the wholesaler is going to sell it to them, and then they have to tack on additional costs for shipping. So we want to consider both the participants as well as the providers, because without the providers, we have no program.
Thank you,
Okay,
Senator.
so
Oh,
I'm
you
not
can come
done.
back.
Can I still ask questions? Or you want me to? Okay, I'll pause my questions.
We'll come back to you. If Senator Taitigui?
Thank you, Madam Chair. And good afternoon, everyone who's here today. Thank you so much for being here. I just want to go back to this whole nemesis of the 115 waiver. I went online, of course, because it's the first time I've ever heard of it. So I went online and started reading about it.
Yes, ma'am.
And if I'm not mistaken, Mike, what we're here today is to discuss, is this considered the first public hearing that is required for you to go through this process?
That's correct.
Okay, so this is public hearing number 1.
That's correct.
And then you're going to have a public hearing number 2.
Yes.
Correct? And then after that, when do you have to submit your findings? Once you've calculated everything and put it together, do you have one more public hearing to present the findings? Because I know the pharmacies here on this island are going to want to chime in on this. We want to hear from them. In fact, so
So it's the second, we have the second hearing that we've tentatively scheduled for, well, not tentatively, but we're shooting for July 5th at 1
July
o'clock
5th.
p.m. And it
Okay.
would be via Zoom. It would be
Okay.
a departmental hearing. We would send out notice to the providers, publish for the public to
Okay.
view that. And then what we envision is emailing to receive the invitation for the Zoom link.
very good, yeah. So that will be number 2, right? Because it says that you're required to. Once
yes.
that's completed, you finish that public hearing, you have a timeline to submit to the center, right?
Yes, we do.
And that date is what, when you submit?
We're shooting for August 1st.
Okay.
That deadline
August
may or may not be met, just because we're,
Behind?
yeah,
Okay.
we've been pushing this, and so
I see.
the window to submit this application, we don't know if that's still open. We have a call with them this week, and we're going to assess where we're at.
So you're going to be allowed by the federal side to give you an additional time to comply with the information, the application, because according to the website, it's an application that you have to fill out, right?
That's
And go
correct.
through the process.
So we have to submit it to them by a certain time that gives them enough time to review, because they also have a public comment requirement where they have to
Right.
publish. And so we've been working with them based on this June hearing timelines,
Right.
and then submission, gather the public comment for 30 days, submit the application by August 1st, and then keep moving forward in order to meet that January 2023 timeframe for implementation.
Yeah.
Again, I'm
Is
not
that January
sure.
23rd, 2023, or January 23rd?
January 1st,
Oh, first,
2023, yes.
Carlos, would this affect the hospital? I don't know why I'm affiliating you with Guam Memorial.
Because I used to work there.
Okay, that's probably why. Okay, they have a pharmacy there at the hospital.
They don't have an outpatient pharmacy.
So do you think it'll affect if, let's say this waiver is produced? I mean,
I'm not absolutely sure, but I would venture to think that it wouldn't. It wouldn't, because they don't have an outpatient pharmacy.
Okay.
Their
that
drugs
explains
are
it.
usually for the inpatient.
Okay. Do you think, Mike, that this would cause some type of, well, I guess everybody contributing one to avoid any high cost to medication by all bringing it at one time, like bulk, with all these pharmacies coming together to try and find a way to make it cost efficient? Because we know this is supposed to help, but
I had thought of possibility of them forming a co-op to
Yes.
order in bulk, but even at that, with the amounts, based on our small population, these major distributors, and I believe there are a few that operate on island that do distribute. Amerisource Bergen, I don't recall the other names right now, but they're like number 1, number 2, number 3 in the nation, and so they deal with the Walgreens, they deal with the CVS,
Right.
and so when you
we're
have
just not that big.
yeah,
to
like
cover
mom
it.
and pop stores trying to compete with
So Mike,
Costco or.
yeah, so my question then, Mike, to you is, why even go after this waiver?
Well, we really wanted to assess to make sure that we're not rushing to participate in something that the federal government has set, but hasn't considered how this affects us because of our remoteness from supply chains. And so rather than do an injustice to both the providers or recipients, we really wanted to take time to see how this is going to impact the program.
Yes, that's it, right.
Yes,
Okay, that explains it, and I appreciate. The last question I have, well, we talked about pharmacies and the impact, but we will know that, I guess, when we have that public hearing, the second public hearing, when we invite everybody to come to the table and kind of see where we're at that point. But it's not like we're required to do this waiver at all. I mean, it's an option that's given to all the territories now, which has not been able to do it. And like you said, it's not mandated at all. It just gives us that door opening. But if it's not conducive to Guam and it costs us more, I'm sure we're going to make those changes. Other than that, Jeff, Janet, Carlos, and of course, Rochelle, thank you so much for being here and providing. And I look forward to that second public hearing, because that's where we're going to really see the numbers. So I appreciate it. Thank you, Madam Chair.
I did. Thank you, Senator. Yeah, so the second public hearing, just to clarify, is one that will be held by Public Health. It's a requirement of Public Health before they submit their application to have 2 public hearings and submit input from everybody,
Yes, ma'am.
stakeholders. Yes, correct. So we've joined together with them today so that their public hearing will be broadly broadcast, and we've invited all the providers on island, all pharmacists, all of the pharmacy board. We've even asked that Medicaid recipients are welcome as well. And I'm sure that that invitation will also be extended by Public Health for the next public hearing. Okay, so Senator Duenas.
Masi, Madam Chair, and Mike, and to the team that's joined us on the panel, thank you for being here. A lot of the technical questions were asked. I wanted to go back to the study. What is the timeline on that, and what do you expect to gain from that?
Timeline as far
As
as
far as the
our
study
assessment?
to be conducted, yeah.
Well, we do have a requirement for quarterly reports, semi-annual report, and an annual report. As we gather information, we're going to actively try to determine if we can get data for certain areas. The cost for a contractor to do the billing for the Medicaid Drug Rebate Program. Again, we're going to reach out to U.S. Virgin Islands. One of the difficulties that we have with our program is that we don't have the IT specialists here on the island. And so we oftentimes have to go to stateside contractors. And a lot of times they don't want to deal with us because our participant numbers are so small that it's not a moneymaker for them.
Yeah, and I guess that's what I was driving at, because it seems to me that in order to arrive at the evaluation and to arrive at whether or not you have a conclusion on the cost-benefit analysis, that's what you're going to need is that kind of that technical comparison and that that data too, because
Right.
otherwise you may just end up in the end with an analysis that doesn't provide.
No. Fortunately, as I mentioned, the U.S. Virgin Islands, they have a similar population of recipients. They're much closer to the mainland, so they, as far as contractors willing to travel to their location as opposed to come out to Guam, that's going to play into the factor for cost, I imagine. But we're going to use that as a jump-off base point for what the cost would be for us to contract for that particular service.
Okay. I guess my final thought too would be, and I think I caught this during the presentation, is you're not locked into the 5-year, even if you were approved.
No. If we had assessed that after a few months of studying this, that it's more advantageous to be on the program, then definitely that's the direction we would want to go. Again, at this point, we just don't know. So rather than act hastily and create more problems than the benefit is going to give us, we'd like to do a better assessment.
Yeah, and that's for the benefit of our public that's watching, right? And this body jointly joining with you for the broadness of getting the word out. I think that's our comfort level at this point. Then we can walk away from the table saying, look, the folks from public health are here. They're evaluating a program in terms of what we could avail to, but we're not looking at locking or committing ourselves to something that in the final analysis with all the information studies and everything we've been able to ascertain, whether or not we get a full-blown contractor or not, or base ourselves on what anecdotal stuff we put together, we wouldn't be locked into saying, oh my gosh, we're stuck with this for 5 years now because
that wouldn't be the
we
case.
went down this road. So just wanted to maybe see if I was on the right track to kind of give our people a little bit more comfort level. So I'm going to continue to listen. Sounds fascinating. I hope that we get the participation from the pharmaceutical companies in your next round, or maybe they'll send you something in writing or the like. But certainly, I think that cannot be a missing link. I think that has to be information that's will be vital to your final analysis. But that's all I have for now, Madam Speaker. Thank you for this opportunity.
Thank you, Senator. Senator Abbott.
Thank you, Madam Chair, Madam Speaker. Mr. Gallo, thank you, and to everyone here, thank you for being here today. I think the question I have is, has any roundtable discussions or any discussions at all been happening with the pharmacies as to this program that you guys were looking at or considering at implementing?
We haven't had an opportunity to do a roundtable discussion with them, but I have reached out to the pharmacies for Payless, Mega Drugs, and had discussions with them as far as the challenges that they currently have with the supply chains and dealing with these major distributors for the pharmaceutical manufacturers.
And were they able to get back to you, or?
They had just mentioned some of the challenges, like what was pointed out with regards to not being able to negotiate a price. When they open up the price listing for medication, it's whatever is there, that's your price. And we don't negotiate with you because you can't meet our bulk quota for discount.
Yeah.
And
I mean,
on top of that, you have to pay for shipping, air freight.
Yeah. I mean, my concern is when we get to the second hearing, right, and that those pharmacies that do participate, those that don't participate, they may come back and say, well, we never knew about this, we were never notified, and things like that. So I'm just trying to see how far out and wide did you go with notifying, all the participants or possible participants into the
So I'm also the supervisor for the claims section for the Medicaid program. And I have 6 supervisors that deal with pharmacy providers. And so prior to this hearing, we made sure to speak to my supervisors to assure that the pharmacies that they're assigned to are notified of the hearing so that they can provide their input. Because we definitely want to make decisions based on a total understanding of what's going on.
Yeah, definitely, because, the impact that it could have on either the recipients of the medication or the participants, the pharmacies, right? Like you said, does the benefit outweigh the risk or the cost of the program? I hope that on the next hearing that we'll be able to get more input, and those especially from the pharmacies and the public at large to see what they come up with. But thank you for the presentation. I think it was very well put together, and hopefully we get more information, and we look forward to hearing on to the next hearing. Thank you, Madam Chair.
Thank you, Senator. Senator Perez?
Thank you, Madam Speaker. So yeah, just a couple questions. If you can unpack this concept of budget neutral, what would that entail? Because in looking over the presentation, it talks about how the rebate program would require drug manufacturers to provide the rebate. So how does that apply to Guam? Is it the pharmaceutical company itself or the manufacturer of the drug?
Okay, so the Medicaid Drug Rebate Program is a contract between the drug manufacturers that want to participate, and they would contract with HHS. We would enter into a contract with the pharmaceutical manufacturers, and then we would supply them on a quarterly basis all the medication that was dispensed by NDC National Drug Code, which drug code is assigned to each medication that's made regardless of manufacturer. So we would collect all that data, send it to them. They would use that information to calculate based on the formula. So the formula was the average wholesale price minus best price, or for brand medication, it would be the average manufacturer price minus best price, or 23.1% of the average manufacturer price, whichever is greater. And then they would also include a inflationary component, and that calculation would be by drug, by NDC. And so it's just rows and rows of data that we would have to report, and then they would calculate, send us the rebate based on what we paid under the program for those particular NDCs that they manufacture. We would get that rebate, and then we would split it with CMS based on the FMAP.
So, we've never done this program before, right? So we don't have a
No.
baseline.
Yeah.
And so how do we determine what budget neutral is?
Well, budget neutral right now, it would mean that we're not requesting for additional monies to conduct this study. We're just using the existing funding to do our analysis. So we're not going to hire an extra person to conduct this study under the 1115 waiver application. We would just have to do it in-house. The assessment would have to be done based on our current resources.
Okay, just for clarification, so the rebate comes from the manufacturer,
Correct.
not from our pharmaceutical on island?
No, the pharmacies, the only reason why the pharmacies are involved is because they purchase the medication through a wholesaler that distributes for a manufacturer.
So I guess the question is, how do you determine budget neutral, right? Coming from our perspective, I think that still needs to be clarified. I don't have a good,
Yeah, so if we were to submit our application and tell CMS that we need to hire 3 more people in order to conduct our study, then that's not budget neutral, right? Because we're incurring additional costs. So if the waiver was not approved, if the waiver was approved, would it cost additional money to CMS? And right now, the answer would be no. If they allow us the additional time, it's not costing them additional money.
yeah, I think, one of the benefits of the program, perhaps I think my colleagues have intimated, is the access to lots of different drugs, right? But then, I think maybe perhaps, are you rethinking your hypothesis? Is there a way to rethink that hypothesis? Because I think it's important to kind of keep the needs, to be able to balance the needs of the community in addition to the cost issue.
As we gather more information, it has changed our viewpoint to some extent on whether our hypothesis needs to be changed. Still in the process of discussing that with CMS and our current management team. This project is complicated to the extent that it has a lot of different components that needs to be assessed. And so it's not something that can be analyzed in a month or that type of thing. As we look at all the different components that's required under the Mdrp, what is that going to require of the program's resources in order to implement that? And that's what we're trying to answer.
I think the drugs are the largest cost, right? I think that's going to be something to think about. I concur with my colleagues that, we do have to look at the interest of the public in regards to access to drugs, especially perhaps the newer drugs, with our high rates of cancer, other ailments that our communities experiencing. I think that's important to look at. Access is important, but we also have to look at the cost too as well, obviously. So I think, I feel like the hypothesis needs to be readjusted.
I guess the only issue that I have, again, is going back to creating an additional burden on the pharmacies. So if the program requirements are so burdensome that it's not beneficial for a pharmacy to say, oh, yeah, okay, I'll provide medication for your program recipients, but you're requiring me to carry all of this medication, I can't do it. And so you're telling me that if I have something in inventory and I can dispense it because it's a comparable medication. If I dispense it, you're not going to pay me. So those are the things that we're trying to assess, as well as whether or not the additional expansion of the medication is going to be beneficial as well. We definitely, as we look at the program, we definitely don't want to withhold benefits or health, successful health outcomes for our recipients. That's not the purpose of what we're trying to do with the 1115 waiver. It's not to nickel and dime the program. It's really just to ensure that as we move forward towards either implementing it or not implementing it, that we're looking at how it affects everyone.
Thank you for that point. Yeah, I do look forward to the next public hearing, but perhaps we can make have a targeted approach with the hypothesis so that wherever the drugs, what drugs are needed here, perhaps allow that, but, have a more targeted approach, I think, is what's necessary. So, yeah, no further questions. Thank you, Madam Chair.
Thank you, Senator. Senator Brown.
Thank you very much, Madam Speaker. And so we see the issues and intricacies with regards to some of these federal programs that sometimes get so complicated that the desired objective doesn't get received by the public. And I'm sure we all agree we would want to maximize the opportunity for our people to participate and receive the needed medication, because certainly not everyone has the luxury of affording all the medication, especially as you get older, that you're being prescribed by your doctor. So I think we recognize that. Just so the public and we don't get the impression, that this is a slow winding down process. I know you have your August 1st. Is that your deadline to confirm whether or not Guam will participate in the program?
We need to
Or
submit.
is it simply your application time and then they determine
Yes, so
you're going to participate or not? Do they review that and say, yes, we're going to include you or not? What happens there?
Yeah, so based on our discussions with CMS, we've come up with an August 1st deadline to submit in order for them to give them enough time for their processes to go through the approval so that it'll be in place by January 1st, 2023. As I mentioned, we've missed a few time frames that we were looking at initially, so we need to reassess with them whether we're going to be able to accomplish this. So
Is it simply an application process on our part, or do they get to review it to determine whether we get to participate or not? What's the next step after this timeline? If you determine we're submitting, do they get to say yay or nay, or is it automatic because you apply for the program, or where are we with that?
So it's a requirement for the publication, the comment period. So the requirement is 20 days prior to submission. We've had to complete the 2 public hearings. And so we've completed one, we have an additional one to go. So 20 days prior to submission. So we're pushing into July. Now we need to have it submitted by August. Additionally, we need to complete a 30-day comment period from the date of publication of our public notice. And so we did publish on the department's website for the public hearing. We are in the process of trying to put that on the DOA site that's under the open government bill that requires
just to
it
let
be-
you know, DOA's website in and of itself doesn't meet the public notice requirements, so be mindful of that.
Okay.
You need to publish it, and you want to maximize the opportunity for people in the public to see this.
Right.
So I hope you're publishing in the papers. I mean, I know the speaker does make the effort to publish all our hearings in the paper, but please make sure you do that for your own Zoom meeting so that at least you maximize that opportunity. But just online does not accommodate that requirement for public notice. Again, just to get back to my question, is this something that I understand you've very clearly outlined the process and procedures you're undertaking to meet these requirements. I'm just asking, once you do that, is it automatic participation, or they still get to review and determine whether or not Guam gets to participate or not?
They review whether or not they're going to approve our application.
Okay, so there's still an approval process after you submit it. It's
Yeah,
not an
so
automatic, we
they may-
apply and we're
Yeah,
participating.
so they may see our application and say, no, this is not going to work. We're not going to give you the waiver. You need to participate come January 1st, 2023.
With regards to pharmacists, are pharmacists, private pharmacists, is it optional for them if they want to participate or not?
They have to be a Medicaid provider, so we would enter in, all our program providers enter into a provider agreement with the program.
Okay.
Yeah, so those are the ones we're concerned
And
about.
do you have pharmacists now that are part of this program, or is this a whole new program?
No, we do, so the prescription benefit is a benefit that the Medicaid program offers, and we do have pharmacy providers that offer Medicaid or...
Okay, but is it optional for them? Do all pharmacists are required to participate, or again, for private pharmacists, is it optional should they choose to participate or not? Like you have some doctors won't take certain programs.
Yeah, so...
Right? So I just want to clarify, because I'm not aware.
Yeah, so the provider agreement, the way it usually works is a pharmacy would say, hey, we want to be on the program. Or at times we also try to encourage providers that are new and that we approach them and say, hey, we have this program, would you like to be a provider? And then we would enter into the agreement with them. But
Okay, so is it optional, just to clarify in simple English?
So-
Is it
so, yeah,
optional or not?
Yeah, nobody's required to participate as a
optional then if
provider.
they
Yeah.
choose to
We don't
participate,
force pharmacies to, we can't.
Do you have, so right now, how many pharmacists on Guam do we have, and how many participate in any type of federal program like this? Just out of curiosity, I don't think they're here, right? Hopefully they'll participate in your hearing that you have scheduled in a couple of weeks to get some feedback.
We have quite a few. I don't have that exact number, but if you'd like, I can provide a list.
It would be helpful to the committee to know. I mean, if
Okay.
we have, 15 pharmacists and we have 7 participating,
I think we have a
think it
little
would
bit
be helpful
more
to-
than 15
and
pharmacists.
also for,
Yeah.
helpful for the public as well, because, I mean, I'm sure, especially the elderly in our community that are challenged and need medication, I'm sure it's a frustration. But at the same time, in order to operate, and I do appreciate the fact that you're going through this process. I mean, everyone can, slam the table and demand, we want this done, as long as it's, being completed in a reasonable period, to make sure it's actually beneficial, because if it's too cumbersome, and then we can't get the medication we need anyway, then where are we with regards to our community?
Yeah, I think for years we've had some difficulty with getting providers because we've had limited budget. From 2016 forward, it looks like we've had some inflow of additional funding, and so the medical providers on island are more want to be a provider under the program, and so we've seen some increase because of the additional funding. But yeah, in the past, it's been difficult. They don't want to, or they'll participate in Medicaid, but they don't want to participate in MIP, or so it's been challenging in the past, but it's gotten better because of the additional funding that we currently have.
And so what will you get besides the medication in this process? Does the federal government subsidize anything further for the government, for Guam in this case, or is it just simply providing access to the medication through these pharmacies should they participate? Let's just sum it up in simple terms, because I'll tell you the last hour for me and most people would be like, it's boring. It's very boring listening to them at the legislature today. Nothing exciting about this subject. But the bottom line is trying to get this medication that these drug manufacturing companies have agreed with the federal government. They've entered into an agreement. They're going to give these medications at a certain cost that's more affordable, we're assuming.
Right.
And that's why this type of program exists, and we want to see if this is going to work on Guam and Kimberley. That's about sums it up, at least in my mind, what we're engaging here this afternoon in this discussion.
Okay, so the way that Medicaid Drug Rebate Program works is the rebate would be provided by the manufacturer to the states, and they're doing that because they've contracted with CMS or HHS to be part of the program, where the Medicaid programs in each state, when they enter into this agreement, they cover all the manufacturer's medication. So whatever they produce out there, if a physician writes a script for it, if it's medically necessary, the program will pay for it. And so they calculate all of those payments that the Medicaid state agencies pay for the recipients for the manufacturer's drug, and they use that number to calculate the rebate. So it's, if I can use an analogy, it's kind of similar to the WIC, right, where they contract for formula. And so Similac, for every Similac that the program, WIC program dispenses under the program, the manufacturer will give them X amount of dollars for each can or bottle of formula that's sold, because it's beneficial for them, because when they're on the program, more of their product is sold. So overall, they have an increase in their sales, but then to offset that for our costs, they give us the rebate.
My last question, because you brought up, because we're a smaller community, there's some disadvantages of scale because we are a smaller community versus CBS and, you know, San Diego or whatever.
Right.
Is that anything that could be looked at for Guam to inquire, or something our congressional rep can look at with regards to that formulation, so that smaller jurisdictions are not at a disadvantage in participating at the best price for this medication versus larger communities that, of course, because of the scale, you know, are able to have it more readily accessible and affordable price?
Yeah. It would be nice if there was some type of federal program that would create that additional savings or subsidy for communities like us. I don't know if that's possible, and how they would create that to create an incentive for the manufacturers to want to participate. Big businesses, you know, they're profit driven, so.
Well, but I think federal policy, I mean, as there are other, you know, benefits for disadvantageous locations according to population, you know, our income levels, things like that have been put in place for other federal programs. I mean, it's just something that probably, since you, and I think it's a very good point that you brought to light about that issue, because we're just assuming everything's equal throughout the system, but because of our location, our smaller population, we're not able to take advantage of obviously the large volume that makes it more accessible for other jurisdictions. So I'm just pointing that out. With that, thank you very much for responding to my questions. Thank you very much, Madam Speaker, for the opportunity to ask these questions.
Thank you, Senator Brown. I had promised Senator Nelson to come back to her if she's in the building. But in the meanwhile, I'm going to ask a couple more questions, if you could clarify. The FMAP rate right now, 89% that we're getting from federal dollars to cover Medicaid, that's the money we're talking about using to pay medicine, right? So whether we pay brand medicine versus generic medicine, currently your office is covering generic medicine only unless there's a medical need for the brand. And that is so that we can use that same money to cover more patients or perhaps more medicine. Is that right?
Right. So because of the additional funding, we've looked at ways to increase benefits, not just for individual recipients on the program, but to make it more accessible to larger households with larger incomes. We've increased the income guidelines. We've included COFAs over the past, I think that was in 2021. And so we've looked at ways to use the funding to cover more of the population. And so it's not just trying to hold on to the money, because at the end of the fiscal year, we definitely don't want to give money back. And I know it's always been a struggle for the legislature to appropriate enough for us to fully match.
Yes, we have not appropriated enough to fully match.
Yeah.
In last fiscal year, or even the proposal for this upcoming fiscal year, if we get this type of matching, right? So, and we want to do that. But yeah, so would you say it's fair to say that, I mean, well, what is the purpose of using generics then? Is it for that purpose that you're describing in order to extend this Medicaid program to more eligible people?
Yeah, I mean, it's to be fiscally responsible to, the generic medication, I'm not aware that it creates negative health outcomes for people that use it. When I go to buy.
So it's more affordable, and we can use the money for additional things if we
Right,
can
and we
buy
can
the medicine at
increase-
more affordable rates.
Yeah, we can increase our benefits like eyeglasses, and so those things we've looked at it expanding, and we have the durable medical equipment, some
right.
cardiac implants. So we've included that, and that's expanded some of the benefits for.
Okay, so have any pharmacists objected so far to this application for a waiver?
Not that I'm aware of.
Have any doctors or pharmacists objected to your current Medicaid drug formulary with generics only unless there's a medical reason?
We have had some instances where a physician, maybe not on island, has recommended a brand medication for the purposes that I had mentioned earlier, because the patient was having difficulty swallowing, but then it was found that those other medications can be ground to be dissolved in liquid to use. And with that particular instance, that physician worked for a provider that wanted to recommend medication that was produced by another company under the provider.
All right.
So it was for their benefit.
I see. How many incidences like that?
Those are few. I mean, there are constant requests for banned medication, and we do give it.
Okay.
If a physician.
So you are granting requests for brand medication
Yes,
when the
yes,
physicians
yeah.
request it for particular purposes?
That's correct.
All right. And under this reimbursement program, that's the same. It depends on what the physician prescribes, you said earlier, right? If
right,
they
but
prescribe.
It would be different in the sense that it would be open to every drug that
Right.
the participating manufacturer had in their line, all the participating
Right.
manufacturers.
Okay, I want you to clarify that. So you said the pharmacies would be required to purchase all medicines made by that manufacturer, any manufacturer in the program, or all manufacturers in the program. So you used one example, Pfizer. They'd have to, a pharmacy on Guam, a pharmacy company on Guam would have to purchase all medications made by Pfizer if they want to participate in this program? And the other drug companies?
Yeah, so I guess the way that it would work, and we were hoping that we could get some of the pharmacies to come in and provide input, but I would imagine that it would be based on their usage. So the types of medication that they dispense on a monthly basis, I would imagine that they would determine what the monthly need is, and then look at, if we were on the program, look at those participating manufacturers, and then try and order enough from the different manufacturers for a particular type of medication to sustain their current prescription. You know, so it's like supplying as you need it, but not over ordering, because you don't get reimbursed if you buy the medication and it expires, then you just throw it away. That's a loss to them.
Okay, so if you order meds and it expires, you don't get reimbursed. If it never gets prescribed after you've ordered it, you don't get reimbursed.
Right.
And are there some that are just not covered by CMS, although they're manufactured by Pfizer, for example, that they would never get reimbursed for?
So if they're on the MDRP, the manufacturer was, then their entire line of
Is covered.
CODs would be covered.
It's covered.
So it would be a challenge, I think, for a pharmacy to try and figure out what medication to order. I wouldn't know how they would determine who to order from, the quantities, the types, based on even their current prescription listing. Because they're prescribing current maintenance medication, I imagine.
But what is the harm in a pharmacy getting some but not the rest, and saying to the patient and to you, we don't have that currently in stock, so you have to go somewhere else? So they only order what they're comfortable ordering. What are the implications of that? Is that like against the rules?
It wouldn't be against the rules, but the participant wouldn't get medication, for one, I guess, because there wouldn't be anybody that they could go to get it.
Yeah, isn't that the current case on Guam right now? There's some certain meds you can only get from one pharmacy. That's my understanding, or at least for certain periods when the rest are.
I haven't personally come across that situation, but I know, again, because of their limitation, that's probably the case, that at times the supply chain, it won't come in, and then they won't have it for a week or two, and then they would have to come back another time. The prescriptions are good for a year, but then that would mean that the recipient would go a week or two without their medication, which probably is not good for healthy outcomes.
All right, is there such a thing as, so you apply for the waiver, you might get a 5-year waiver. Is there such a thing as a permanent
No.
opting out? So eventually Guam will be included in this program, and pharmacies have to prepare for that?
Yeah, we would need to request for an extension.
I
So
see.
in order for it to continue. And again, even though it's normally approved for 5 years, it doesn't mean that it's going to be approved for 5 years.
Okay, yeah. We're looking at, depending on how CMS judges, how long it should take you to get these questions answered, right?
Yeah, or their
And
assessment
determine
of
your
our...
cost. It's like a cost-benefit analysis. But in the end, even if it's not beneficial, let's say, or we might lose pharmacists, you're saying we might still have to implement unless we get another waiver from CMS for another period of time?
Right.
Okay. And yeah, I was just going to suggest to you for your next hearing to please notify the doctors so that they can weigh in. For me, if the doctors are not pounding down your doors for brand name medicine, then we're okay. If they're saying that is urgently needed and it's being rejected too easily, right, by public health, we need this program so that all medicines that we can prescribe are all medicines are in the range of what we can prescribe, pretty much, is what we're trying to tell them. I don't know, I'd just like to hear from them what their input is, in addition to the pharmacies, and what impact this would have on them. All right, I want to thank you. I know this is it's not the most exciting topic, but it's very important for we're talking about patient care. And so I would like to just, if you could, describe it in terms of patient care, right? So they get options, of course, of which medicine they're going to get under this program. And they're already covered, their medicine's already covered under the program. We're giving them, and if the doctors want to try additional medicines, those will be covered under this program if we get under the rebate program. And for now, they can still be covered by any type of brand name medicine if the doctor justifies that.
Yes.
Okay. Well, that sounds great to me, as long as the doctors are aware of that and the pharmacies bring this medicine to Guam. Sometimes they don't bring it at all, and it's just not available at all, right? Okay, all right. Senator Rodriguez, is there anything you'd like to add? If you would. Senator Taitigui, a question?
It's just a suggestion, if I may. Mike, when you contact the pharmacies that are on island, way before the public hearing, if you can provide them the guidelines and exactly what it entails, instead of just saying, hey, we're coming for a 1115 waiver, and then, show up. It's important to get them well-versed and well-schooled, so when they do come to the public hearing, they understand exactly what this will entail. So I appreciate if you can do that beforehand, before the public hearing. Just school them what this 115 would really do for them, okay?
Yes,
That's
ma'am.
all, thank you.
I also want to acknowledge what you said earlier about how it was difficult to get Medicaid providers, medical providers, for a time there on Guam because of slow payments or, from Medicaid to the providers. I think it was payments, and now we are in a good situation where it's much more attractive to providers to cover Medicaid patients. So that's great. I want to thank you for that work in that regard. And we don't want to go backwards with our pharmacies, where right now we have pharmacies who are providers, and we don't want to create a situation where they are going to opt out of the program, right? That's your goal in doing this cost-benefit analysis.
Yes, ma'am. That was our concern.
Okay, thank you. And so Senator Rodriguez.
Hafa and good afternoon, Madam Speaker and Senators. Thank you very much for allowing me to just chime in. I want to thank the public health folks for being here. And, from the governor's office, we're going to provide the support and assistance that's needed to move this forward. And just want to assure you that this government would never jeopardize our patients receiving any type of medication, whether it's covered under the Guam formulary, the prescription formulary that we currently have, or if we do have to implement this Medicaid rebate, prescription rebate program. And so I think, what they're trying to do would also give us an opportunity to, look at as the governor has her initiative of getting our GovGuam health insurance into some sort of self-funded program at one point in time, and perhaps looping that into a Medicaid program, and also the vision of expanding our Medicaid program to at least up to 300% of the Guam federal poverty level, which I believe right now it's 200, is that 200 or 138, right?
Currently, it's at a 138 local poverty level.
Yes, and so as we move to increase that to get more people eligible, this time frame that if CMS does approve this waiver would give us that opportunity to make that determination. As you know, that pharmaceuticals is one of the biggest costs in the delivery of healthcare, and so we're hoping that that's something that could be considered as we move forward as well. So.
Thank you, Senator. Senator Rodriguez, what is the, what do we need in order to increase it to 300%? Is that just a determination, like a rulemaking, or is it going to be something more than that, or in addition to the state plan?
Yeah, first of all, of course, is to make the determination, what does increasing it to 300% mean, and what does that mean financially? And if we're able to afford that, if there is that the will of our government to support that type of expenditure, we're watching very closely the FMAP formula changing after December, and so we're hoping to be able to develop a plan that we can also take to the federal government, aside from this Section 1115 waiver. Perhaps a separate type of application that would give us the opportunity to expand a new program under Medicaid, and so that's why it was something for us to be able to be here and support them with this Section 1115 waiver, is because that's part of the process. As you know, this legislature has passed several years ago. In expanding the Medicaid program, and part of that is pursuing a Section 1115 waiver.
All right, but from 138% to 300%, what is necessary for that?
what's necessary is to, we've been working with public health, so Carlos can.
Sure,
We
Mr.
would-
Pangilinan?
We would have to ascertain how many people we would have to include in the program, additional people. And when we've studied that and we find out how many, then we can project a cost. We're not at that stage yet where we know it. But if I could just, may I bring up one point, because I was, with respect to Senator Perez's concern, I've been with the department for almost a year, and I'd just like to say that there are many different ways, well, there are several different ways of changing the benefits. And in the time that I've been here in the last year, there have been probably a dozen or so, or half a dozen or so, state plan amendments. The vast majority have always been to expand. So I just didn't want to leave this room giving the impression that because we don't want to participate in this drug rebate program, that's all we ever really, we're just looking for ways to not participate in these federal expansion programs. But yeah, we talk about expanding all the time. Just a couple of weeks ago, we were looking at a wellness benefit, which we don't have currently.
All right, and so we are, is it an amendment to the state plan that's required for the 138 to the 300%?
I'm not sure. That's something that our team here.
I'm sorry if I could interject. It would probably be a state plan amendment.
All right. Okay, thank you. All right. Anything else? If not, then thank you and good luck on your next public hearing. I hope that the pharmacies are responsive to that, and I will shout it out as much as I can. But there being no additional individuals to present further testimony, this joint public hearing is now adjourned. Guam Medicaid recipients, pharmacy providers, and stakeholders can watch the proceedings on Guam Legislature's YouTube channel, and they are invited to submit written testimony via email to Mr. Michael Gallo, Program Coordinator with the Guam Medicaid Program at Michael, capital M, Michael.Gallo, Gallo, at DPHSS.gov, or to Mr. Jeffrey Sanicolas at Jeffrey with a capital J, Sanicolas at DPHSS.guam.gov, or by hand delivery to the Guam Medicaid Program, number 130 University Drive, Suite 5, Castle Mall Building, Manila, Guam 96913. To all of you from Public Health and to the Governor's office as well. And to my colleagues, thank you very much for your interest and participation in this hearing. So we are now adjourned and the time is 2:55 p.m.